Hello, my name is Cynthia Tony, and I am pleased to do my SBAR for Phoenix University MHA 599 on small populations, Schenectady, New York, of 153,000 plus. The current healthcare system is a hybrid system with single payer with private insurance mandates. Client can also pay out of pocket. The triple aim of healthcare is to improve the experience of healthcare, improve healthcare population, reduce per capita of healthcare costs, and now the current crisis is COVID-19 SARS-2, which is acute respiratory disease. This disease has started since 2019. We are currently year 2021, and we are now in October, approaching November, and the number that has been affected worldwide is 55 million infection worldwide of SARS-2 COVID-19. We have 1.3 million deaths. Schenectady, New York is a county, is one of those areas that are considered to be small population in New York. It has 155,739 individuals. Schenectady, New York is 20% living under the poverty line with less access to health care. This means less people have insurance. With COVID-19 being a pandemic in New York, there has been 200,000 plus Americans infected in the state of New York itself, and Schenectady is one of those areas which has the more prevalence. So this SBR is to identify this niche and to provide a recommendation which can reduce the effect of COVID-19 and the further spread of the virus, which is spreading like wildfire since 2019 from Wuhan, China to the United States and across the globe. So, what is SARS-2 COVID-19? SARS-2 is the pathogen which causes blood hemolysis, respiratory infection, which is acute respiratory infection. This has further affect people who have asthma, and SARS-2 COVID-19 also affect people with a secondary disease which calls Heaven's disease. Heaven's disease only lasts for 1 to 8 years, and then you are dead. So this is important. So what is my recommendation? What is my assessment and my recommendation? Now that you have known the situation and the background, now let's go with the assessment. Schenectady, New York only have one hospital system with 3 centers. So while this was working somewhat for Schenectady, But with the SARS-2, COVID-19, and coronavirus, there is an inundation of the hospital. Here in New York, in Queens, New York, where I live, the hospital were quadrupled in occupancy. However, Schenectady really feel the pound of SARS-CoV-2. August 3, we had 15,000 people affected by SARS-2 COVID-19, the disease coronavirus, in Schenectady. 7-day period. August 3, 7-day period. From August 3 to August 10, there were 15,000 people affected by COVID, but were reported to have SARS-2, which caused the disease coronavirus. So, what is having disease? Having disease only give you 1 to 8 years to live. It causes blood hemolysis, blood platelet hemolysis, and white blood cells hemolysis. So, is to have medicine to clear the disease in times, and also to have vitamins to bring up back the blood. But the issue here is occupancy. We do not have enough hospitals that can respond if this disease get more out of hand. So the best thing we could do, the fastest, is to have clinics. So this is my recommendations. So our clinic will be mobile clinic in front of schools, and as well as a number of clinics which is access for communities. Okay, so we propose 10 clinic. That's my proposal. And the 10 clinics of 6,000 to 7,000 feet square area, we can have a waiting area. In this waiting area, we have plexiglass, which is recommended by the CDC, where people can get oxygen. About 10 people can have in that area, 10 to 15. And then another waiting area, which is separated again by plexiglass, which we can have people take oxygen. Area 1, COVID-19 clients. Area 2, non-COVID clients. We have a 4 exam room. We have lab, and we have x-ray, reception desk, sitting area, single sitting area for clients with COVID-19 to get oxygen, and to go into bed if needed to get oxygen, and as well as treatment. So with this, we know that the CDC requires 6 feet apart, so wide hallway for ambulatory for the patient to be able to get out of, to enter and exit. So we also have nursing station. So our mobile crisis clinic will be able to function on sustainability efforts solar panel, which will help the clinic to sustain and go for more than 1 year throughout this crisis, and to further to normalcy when this disease subside. So let's talk about the numbers quickly. In terms of the costs, we will run with nurse practitioners, nurses, and as well as physicians, lab tech. So this will be around $500,000 costs in the beginning, and which is not that much at all when we think about it per clinic, and that's because it will run on with power professionals and professionals, and this will help with one IT guy per 5 clinic. So this will mean that we are using less in only one server system per clinic. So this will reduce errors and as well as costs. So I know that I said $500,000. That's on the hard resources, and I'm sure medicines and oxygen is not included in that cost. So again, my name is Cynthia Tony, and thank you for reviewing my SBAR on small population, Schenectady, New York. Thank you.